Hi, my name's Emma and I'm co-founder of We Can Access and parent to two children with special needs and disabilities. I just wanted to take a couple of minutes today to share with you an experience that I just had with my daughter with an organisation called CAMS, that's Children and Adolescent Mental Health Services. Now, many of you, those of you especially who are parents, may be aware of CAMS. They are the local authority provision for mental health services for children. And certainly in the UK, they're notoriously difficult to access, and it's also can be difficult to, once you have accessed them, to continue with their treatment. They're very underfunded and under-resourced in this country. And in the area where my husband and I used to live, in London, nigh on impossible. You know, it can take up to 2 years to get an autism diagnosis for your child, and really, quite often your child really has to have made a suicide attempt before they will contemplate seeing you. So it's been very frustrating, certainly for us, for years and years and years. My daughter, because she became deaf as a result of her radio and chemotherapy, she was referred to Deaf CAMS years ago, and we were rejected. We don't know why. We didn't chase it up at the time because we were so exhausted from all the other cancer treatments and everything else that we've been going through. A few years later, both of our children had anxiety, and we approached CAMS again, and they gave me cognitive behaviour training, which was great, except both my children, it wasn't appropriate for us at all. It didn't help. Both my kids would say, "Mum, we know what you're trying to do," when I used the techniques that they showed me. "No, we know what you're trying to do, and we're not going to go with it." So that didn't work for either of them, and certainly they didn't get any face-to-face time. Nobody spoke to them. Nobody has counselled them. It wasn't till last year that we managed to engage to a certain extent, certainly for my son. He got 8 sessions of therapy, and many of those were cancelled. And my daughter was refused it because she was seeing somebody, a counsellor, a psychotherapist, because she had to have another operation on her jaw, quite a big one. And they said, "No, you're already seeing a therapist, you can't see us." And so that was frustrating because obviously it was for a specific medical event, not to help her overcome her anxieties and her depression throughout life. And it wasn't until February just gone that we finally managed to get her seen properly and get her assessed properly. But all the while we're doing that, I felt, like I had to justify why we were there. It felt like they thought I was gaming the system or just trying to do this for my child because, I don't know, why would you go through this for your child if you didn't need it? But, there's this thing, what are you doing here? Do you really need to be here? Questioning the whole time. And it was very frustrating, but we did see somebody and we got a diagnosis. But I had been struggling to get her, she was put on medication, and I was struggling to get her medication reviewed. I haven't been happy with the effect it's had on her. And it's just been difficult from start to finish. We've just moved boroughs, and we've moved into a new local authority area, and all of the healthcare and support we were getting is starting to move over. And we had our first meeting this morning with the local CAMs. And the difference, it was just, oh, I can't tell you. The person doing the assessment was kind, she was understanding, she'd read the notes, which was brilliant. She looked at Addie and she said, you know, I'm not going to put her through all of this again. She's obviously getting stressed. We'll stop if we need to. I can ask you any questions over the phone. You don't, you know, that's okay. She laid out, explained very clearly what she was going to be recommending for us, so I was in no doubt. She laid out very clearly what services were available to us, so I was left in no doubt. And I even got a hug at the end. I got a bit tearful, and she gave me a hug. And it was as though there was no judgment for bringing my daughter in. There was no pressure on me to prove what I was talking about. It was just, and I left that room with hope. I'm exhausted emotionally. These things just drag it all out of you. No matter how positive, it's still tiring. But at the end of that, I feel hope. And I felt listened to. I feel hopeful. And it was just a totally different experience. Now, I don't know why one local authority can produce one way of doing things and another local authority does it a completely different way. We need to look at that, and we need to look at what we can do to make parents and young people feel that they are able to go and ask for help without judgment, without fear of being treated poorly, without fear of being told they're not eligible or they're not worth it. Anyway, but good people are out there, and keep your fingers crossed that things will be moving forward and getting better for our daughter. Thank you.